time for a pediatrics update, I guess, recap. I am already into day 4 of urgent care, just got off my shift, did my first laceration repair on the face, so I'm a little behind, a little spastic. Anyways, let's backtrack. I did pediatrics in Hawaii. If you didn't know that, everyone wants to know how that happened. I connected with someone on Instagram. They invited me to go do my pediatrics rotation there, so I highly encourage you to network, connect with people, especially if you want to do rotations out of state, you want to do them with a specific provider, you want to work in a specific specialty upon graduation. Do your due diligence and network, and it doesn't hurt to ask. The worst they can say is no. So let's dive in, starting with our schedule. So at this particular office, I arrive every day at 7:45. Most days I was there until about 5:30. However, Wednesdays and Fridays, we're supposed to get off a little early, around 2, sometimes a little later, sometimes more like 4. The office also operates every other Saturday, but they did not make me come in as a student on Saturdays. Thankfully, I had a lot of studying and some family and exploring to do. I did go in a couple times to the hospital. I did do that on a Saturday morning for a newborn exam. I also saw a circumcision after work one day, which was really interesting to see. I have a recap of that on my Instagram in my stories. But overall, I really still enjoyed peds. It's one of those, one of those specialties where look at this hat. Anyways, one of the specialties that is super rewarding because you really get to make an impact on these patients' lives and their lifestyle choices. And one of the biggest takeaways was how much time my provider spent with the patient. If it was like a new mom or even a mom who has already had kids but now she's having trouble breastfeeding, taking the time to sit down with them and help them figure out how to latch. I loved that. I loved all the thorough answering of questions about, not just new parents, but any nervous questioning that they might have. So, of course, lots and lots of newborn exams, well child checks from infant all the way up. And then we kind of focused on well child exams for the first 2 weeks and then introduced more sick visits towards the last 2 weeks. I really love that this provider or this office was not turning away sick kids just because of COVID. So I was able to see a lot of strep throat, abdominal pain. We did plenty of COVID swabs and they weren't scared to see a fever, etc. Things that you should prepare. Of course, everyone says, milestones, vaccine schedule, all that good stuff, common pathogens like otitis media, strep throat, and like the first line treatment for those, of course. Biggest thing is being friendly with the kids, making sure they're comfortable with you as best you can. Some of the most amazing things about Hawaii was the culture that I experienced there. And they call everyone auntie and uncle, even if they're strangers, so it made the kids and me feel, less stranger-like. I don't know how to say it. More comfortable when they would say, oh, is it okay if auntie examines you? Auntie's gonna, swab your nose. Just made it feel more personable. I don't know how to describe it. It's really great. Man, the culture out there is wonderful. So much food is how they show love. Patients would bring in food all the time. Office would get us food all the time. One of the most amazing things there. I think that's really, not something that's unique just to Hawaiian culture. It's, prevalent in a lot of cultures. I'm going on a tangent. Overall, peds, still one of my favorite specialties. Didn't love doing vaccines, but I'm comfortable with them now. I hate inflicting pain on the kiddos, but they recover fairly quickly for the most part. And yeah, one of the biggest things I learned was even if they have completely normal exam, well child check, they came in there for something, they want to take away something. So parents brought in the kid, totally healthy 8-year-old, make sure you still give them some sort of piece of advice to take home with them. And have fun. They love stickers. They love just chatting with you, ask them about their drawing. I love that this office would give baby binders to every new child and has in there, all their growth charts, all of these handouts for recommendations, and their drawings at every visit. So yeah, I took a lot from this rotation and a lot that I will be able to instill in my future practice. I hope you enjoy peds. If you have any questions, always feel free to let me know. You can drop a comment below, you can subscribe, ask me a question on Instagram. See you next time. I have a lot to tell you about in urgent care. Bye.